Hi, my name is Camille and I am a radiology technology student at the Federal Technological University of Parana in Campus Curitiba. Hello, my name is Fernanda. I am a student of the Radiology Technology course at the Liberal Technological University of Parana in Campus Curitiba. Hello, my name is Iohana. I am a student in the Technology and Radiology course at the Federal Technological University of Parana, Curitiba campus. This video about Autism Spectrum Disorder is presented for the Human Anatomy 2 course and for the Stimulus project, both taught by Professor Claudia Pruss. What is autism in terminology? Autism spectrum disorder, abbreviated as ASD, can be defined as a neurological and developmental disorder that affects how people communicate, learn, behave and interact with each other. It is considered a spectrum because there is a wide variety of types and symptoms that people can present, each with its own uniqueness. It is called a disorder because they are psychological or mental conditions that affect a person's normal life, which differs from the concept of disease. According to the DSM-5, an acronym that comes from the English Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, autism now also encompasses other disorders that were previously diagnosed separately, such as childhood disintegrative disorder and alcohol syndrome. Due to this update of the DSM-5, the International Classification of Diseases, the ICD, led by the World Health Organization, also changed the classification of autism from ICD-10 to ICD-11. The anatomical regions most affected by autism are the brain, called the encephalon, and its structures. The brain is the main component of the central nervous system and is located in the cranial vault. People diagnosed with ASD have different patterns of brain development, which can affect some structures, such as the limbic system, responsible for emotions, which is composed of the hypothalamus, thalamus, amygdala and hippocampus, in addition to other structures, such as the cerebellum, cortex, white matter, corpus callosum and frontal lobe. This difference between brain structures is identified through magnetic resonance imaging. People with autism may have a difference in the type of cortex, the outermost gray layer of the brain, accompanied by changes in a type of neuron during development. Some children diagnosed later may have excess cerebrospinal fluid, a fluid that runs through the ventricles of the brain and spinal cord, responsible for cushioning and transporting nutrients. This contributes to an increase in head size and severity of symptoms. This excess can persist from 6 months to 39 years of age. Children and adolescents with autism generally have an enlarged hippocampus, the area responsible for forming and storing memories. However, several studies have not yet confirmed whether this difference persists into adulthood. The size of the spinal cord may also be different. In some cases, it is smaller if the person has anxiety along with ASD, and in others, it is larger in children at the beginning of development. The white matter, composed of long bundles of neurons that connect brain regions, is also affected. The absence of a part of the white matter tract, called the corpus callosum, which connects the left and right hemispheres of the brain, indicates a higher likelihood of autism. People with ASD have less brain tissue in the cerebellum, a region responsible for balance, cognition and social interaction. The frontal lobe is also affected, and is responsible for cognitive functions such as decision-making, problem-solving and social behavior. Genetics and heredity. Understanding the genetic factors involved is important to unravel the complexity of the web. Studies show that autism is hereditary and associated with multiple gene mutations, resulting in genetic heterogeneity. Chromosomal abnormalities are also a risk factor. Studies show that 7% to 10% of children with autism have chromosomal deletions and duplications, which influence the autism phenotype. Many genes associated with autism are responsible for changes in protein synthesis patterns, which affect transcription and gene expression. With this, researchers have identified several genes that are commonly associated with autism, involved in synaptic function, neuronal communication, and brain development.